So today we're going to talk about adhesive capsulitis, or commonly known as frozen shoulder. So they're basically what frozen shoulder is. It's pain in decreased motion, range of motion in the shoulder joint. And there are two types. So there's a primary adhesive capsulitis, which occurs typically for an unknown reason. You just kind of wake up and you start to notice that the shoulder just gradually starts to get limited in its range of motion, and you start to have pain. Then there's the secondary, which is the most common, and it occurs after some sort of surgery where you are just not using your shoulder as much. All right, so there are 4 stages of adhesive capsulitis. So stage 1 is the precursor phase. So this is when you start to notice just increase in inflammation, and you're starting to get loss of range of motion in that shoulder. Stage 2 is the freezing stage. So this is actually when the loss of range of motion becomes more and more, and this can take weeks to months to develop this stage. Stage 3 is the frozen stage, so you actually have very, very limited range of motion in that shoulder, and you're starting to get some pain with that. And then stage 4 is the thawing stage, so you have a little less pain. You still have limited range of motion, but it's getting a little bit better. So sometimes this thawing stage can actually take quite a bit of time, and we have to be realistic of the expectations when we're dealing with adhesive capsulitis. So sometimes that stage 4 can take up to 9 months to sometimes even a year to get that range of motion back and that mobility and full function back. And that's without any treatment or anything like that. So when a patient comes into the office, typically they are already feeling pain. They're limited in overhead, putting on clothes, reaching around the bra to hook your bra strap. They're unable to do everyday things, and that usually brings them into the office. So they're already in that kind of frozen stage. And so with the help of, some chiropractic adjustments, some manual therapy to really work on some of the frozen muscles to get them nice and loose, some dry needling to really help get in there, and then as well as just some exercises and some stretches to try and gain mobility, get that range of motion back, decrease some of those frozen muscles to really help improve and speed along that recovery. But ultimately, it is a very slow process, and it's just all about having a realistic expectation that it might get better on its own within a month to a couple years, but with the help of chiropractic and some of the things that we do in our office, we can kind of speed that up and just work through to decrease your pain a little bit quicker, and then to regain that mobility, so at least you can take care of yourself day to day and do all of those things that we start to miss out on when we don't have that mobility of the shoulder. So what we're also finding is that you are more at risk for developing adhesive capsulitis when you are either type 1 or type 2 diabetic or have thyroid issues as well. And then also, if you've had one episode of adhesive capsulitis in one shoulder, you are more likely to have adhesive capsulitis in the other shoulder as well, eventually. to help decrease your pain, increase your range of motion, and get you back to doing the things that you no longer can do because of that limited range of motion. So please give us a call at 513-463-3011 and we'd be happy to help.